Peace and blessings, family, and welcome to Tea Time at Harmony. We invite you to come take this journey with us. This journey to holistic healing. Let's go. Ooh, that was a journey last time.
Was it?
Yeah.
Was it? Good to be back.
Right? Welcome back, y'all. Y'all ready? See, we just got comfortable this time. We wasn't going to do that shit, trying to start off and, being primper. Nah, we got comfy real quick. She done brought the blanket up in here this time. Welcome back, y'all. Tea Time with Harmony. How you feeling?
Feeling good.
Yeah?
Yeah.
Yeah, I was thinking about some of the things we was talking about last time and that whole collectiveness, right? And what I thought about was it's the same thing with how we deliver services, right? And thinking about who we're serving. And we don't even say all of the things. We talking about, somebody knocking at the door. Oh, look at her ass coming on in here. Come through. Cutting up.
What is going on?
You already know.
Just talking about stuff and people.
Okay, all right. I like that.
See? And actually, her ass come through at the right time because what I was just about to talk about is how we treat the whole person.
Yeah.
Oh, okay, wonderful.
You are definitely part of that.
Look at you, the whole person, y'all. Well, first, we got to tell the people who she is. So y'all know me, owner, founder, but definitely part of the journey. We all on a journey.
And San, Department Director of Wellness and Admin.
And now we have another family member who is joining us today. Because she came through. Who you is? Where you at? Where you from?
Wonderful. Well, I'm Dr. Charlene Whitaker Brown. I am the clinical director here at Harmony Health. So I'm so excited that I walked in at the right time.
Yeah,
this
what
is
you do?
exciting.
What you do?
Well, I'm a dual certified psychiatric and family nurse practitioner.
That's right.
And
Say that.
there
Say
you go.
that.
Say it.
Take up space, sis.
All right. And so here at Harmony Health, what I do, I see patients for medication management. So that's so important. So I think, how the integrative care that we're doing here, it's just so important to have everything housed under one umbrella. So
That's
what I do here.
What is medication management?
Yeah, I'm glad you asked that question because a lot of people don't understand.
Know,
They're
right?
like,
Just can I have some meds?
Correct.
Because my doctor said I need this.
correct.
Well,
That's
what
what
is
a lot of
this?
people say. Or are you looking at my medicine list and what are you doing? But what I do as a psychiatric nurse practitioner, I diagnose, prescribe, and treat. So if patients need medicine for, let's say, depression or anxiety or OCD, I can prescribe those medications and take care of them from there. I also see some patients who also have like ADHD as well.
Right.
So yeah.
And what is treat?
So treating and seeing patients regularly. So oftentimes I'll see patients for follow-up medication management like monthly. So I'll see them on a monthly basis, making sure they're doing well on their medicine.
Right.
I also inquire about blood pressure and heart rate. So I do some biometric stuff as well. So it's so important.
Why is that important? Because, we think that shit is separate.
Correct.
Well, I'm over here. I got depression.
Right.
But that ain't attached to my blood pressure. Can you speak to that a little bit? Because we about to dig into this. We was actually about to talk about the whole goddamn person. And this just, we're going to get into it.
This is perfect.
We're going to get into it.
Yeah, exactly. So what I do with my patients, I say, listen, every time we have an appointment, so I see patients in person and virtually. So if they're virtual, I always recommend that they get one of those home blood pressure cuffs. I prefer the one that goes around their arm instead of the one that's around their wrist, because there are some that go around the wrist, but I've been in healthcare so long, I really think the one around the arm is the best. Okay. So I'll tell the patient, go ahead while we're on camera, because I want to see it. Take your blood pressure, hit the button. I'll let them do that. We'll get the heart rate. And so that's just helping us as we're navigating through, right? So we say everything is a collective, right? It's so important. Right. So we need to know what your blood pressure is. I don't want to be talking to someone and their blood pressure is like 200 over 100. You need to be like in the urgent care ER, right? So it's important to know like where we starting from, what kind of foundation we have until we, move forward. So that's so key.
That's why she part of the family, right?
Part of
That's
the
So,
family.
what is the name of the practice that live in the house? Because
Okay.
people think this collective got to be so much, and they don't understand. We got like how they say, I got friends with felonies LLC. We got like 3 LLCs
Sure
on this
do.
mofo.
Yeah, so it's a good collaborative practice, affiliates, all of those things. So it's a Mind Heart Institute and Wellness Center. So that's the name of the practice that I own, and I treat patients across the state of North Carolina. So
That's
not
right.
just in Charlotte,
That's right.
not just in Concord,
That's right.
Pineville, South Charlotte, Morrisville, but across the whole state.
That's
The
right.
reach is far.
the
I know
reach,
that's right.
yes, absolutely.
How
Spot.
many years? Put that out there.
Yeah,
Y'all
absolutely. So
listening?
I've been a nurse practitioner since 2011.
Come on
I've
now.
been a nurse
Dope.
practitioner since 2011.
And she teach.
And I teach. Oh my goodness.
What do you
You
teach?
know, we bringing it all out. We ain't
Well,
had
we
you
got-
in there. We got you in the house.
Yeah,
We
well,
got you.
let me
You done came home.
get
Yeah.
comfortable.
Get
Comfy now. Y'all
Like
want to
that.
go on down
There
deep,
we go.
don't you?
Yeah, we do.
Yeah, so I'm a clinical professor in a school of nursing at the University of North Carolina at Charlotte. So
49er.
The 49ers. Yeah, so I teach across the curriculum. So I teach undergraduate nursing students, graduate nursing students, and doctoral nursing students. So across the curriculum I teach. I've been at UNCC since 2013. So
Damn.
quite some time. Long
I
time.
know that's
yeah.
right. Presenting,
And-
research.
Yeah.
I turn around, see your name popping up on shit. I'm like, that's my sister.
Yes.
How come she ain't tell me about that though? I'm just saying.
Yeah, so many things pop up. So yeah, I love it there. I've been there quite some time and worked my way up. So now I'm not just clinical professor, but full clinical professor.
I know that's right.
So
say
I
that.
am
Say that one more time.
Full clinical professor.
Okay.
Yes.
Tell them who that is.
Yes.
Tell them who you is, where you from, where you at.
That's
at the Harmony
right.
Health.
That's right. So that's a little bit about what I do at UNC Charlotte. So now getting back to Mind Heart specifically.
Right.
So Mind Heart Institute and Wellness Center actually just celebrated its 1 year
Yes, we
anniversary.
did. Yes, we did.
Yes.
I remember that day.
Yeah, so excited about that. So private practice for 1 year. So it's so great to have that platform right now, have that opportunity. But prior to that, I treated patients with heart failure.
That's right.
And I worked for Sanger Heart and Vascular, I tell you, from 2012 up to last year.
Wow.
And so that's why I find it so important that patients tell me what their blood pressure is, tell me what their heart rate is, right? Because it's critical. It's very
Right,
critical.
right.
And just coming from a background where I had to treat patients with heart failure, that's kind of how I got into really wanting to do psych.
Wow.
Because a lot of those patients had depression and anxiety, and I felt bad because I was just treating half of them. I'm just treating their heart failure, but I could see I wanted to treat the whole person,
Come
and I
on now.
wasn't doing anything for their depression and anxiety. Imagine you having heart failure, which is a diagnosis that you can't really turn around. So it's inevitable that you're going to die from having heart failure.
Damn.
So that's just, just
about
knowing
my
that
thoughts
is
and
so
my
deep.
grief.
Exactly.
So it's all tied in, is
Yes,
what you're saying.
it's-
Every
I
aspect.
might
Every
be
aspect,
stuck in
yeah.
denial.
In denial, grief, all of those things.
My loved ones.
Loved
transit,
ones.
change.
Lots of it. So
People don't deal with change.
And
People
what if
don't
it's
deal with
hard
change.
stuff, right?
yeah, absolutely.
We're talking about stuff that passes generations. So now we're
Yes.
expecting.
yeah, exactly.
And now we're worried about if we have children, we're gonna pass this down and now harm our children or
Right.
create problems for our children.
Right.
We're gonna talk about that next time,
Yeah,
right?
I'm
This
looking
is
forward to
thinking
that.
about this with generational trauma.
Right. Yes. Yeah. Absolutely.
We disconnect the fact that the medical trauma, and particularly Black and Brown people,
Right.
and the conditions that we carry disparately,
Yes.
that we already predetermined to pass that shit down.
And that's deep.
And we
so
don't
quick.
even think about. Hold on, okay, y'all. That's the next journey. We're gonna come back because we're
I'll
gonna
be
come
here
back
for that one for sure.
You better come back for that. But you see how that work?
Yeah.
Like how we just. Ooh,
yeah.
how that's coming up that we don't even connect medical trauma
Right.
to generational trauma.
generational trauma.
You said something. The whole person. We were just talking about treating the whole person in our whole model here, right?
Absolutely.
And I remember saying, we have been working to get integrative care here for so long because of that.
Right.
So I have a surprise I'm gonna share with you before the end of today.
Oh, Oh, I'm excited.
Because I was going to call you, but you popped up.
All
I was going
right.
to call her because of what happened yesterday. I don't know if you remember with the American Heart Association. No, I didn't get to share you. I'm surprised I'm both of them.
like,
I'm
like, I was with you, but I don't
It
remember.
wasn't. It was last night. You left after. So we had counselor appreciation last night. After we left and all day, Instant
Yeah.
Tobacco Coalition. That was today. It was the
Yeah.
launch yesterday.
Yesterday, yeah.
And then right from there, we came to celebrate our counselor family. And that,
That was
was
so
dope. So
nice.
you end up leaving. We didn't leave till like 11. Just,
that was
just
nice.
reminiscing and having some enlightenment, like, on things. And so it was a great talk. It was like, we all tired. Let's go home. But there was I gotta share. Okay, so I'm gonna come back. So when we
Harmony
think about
tea.
the right,
I
the
know,
tea,
right? I need to
we
get my
gotta get you
cup.
some tea.
I know. I
You
gotta
wanna
get my
go get a
cup.
cup?
No, I'm good right
You
now.
want to take a break? Okay, it's cool. Don't forget, I was thinking about it when we was coming in. I was like, oh, we should have told her. We should have turned on the tea, had the water ready so everybody can make their tea coming on in the
Next
house.
time.
That's right. So when we think about the whole person, my vision initially. So last week we was talking about African-centered healing and
Yeah,
why
yeah.
is the collectiveness, the connection is because in Western culture we have been. Heart is over here. Your lungs is over here.
Yes.
Your mental is over here. Your foot is over here. Yet the bloodstream that carries the chemicals that tells us an alarm system with our brain and we emotionally responding to, and the cortisol levels directly impact our heart rates and our blood pressure and the
Yes.
things, right?
Yes.
And and so I do a training with the Mental Health 101, understanding that it's all connected and disrupting this individual, that physical and mental health. And so when we designed it was from the treatment process to, the assessment to treatment planning to delivering intervention. And people are like, why is that such a big thing? Why, like, you harp on these first 4 or 5 sessions? And I was like, because it's all connected. We're not doing a checkoff list. We're not doing, so one of the things I was saying recently, and after supervision, I was like, let me do this reminder. We're not here to assess, to diagnose people.
Right.
We are here to look at human beings and look at all the damn pieces to their puzzle.
Yeah.
Yeah.
What makes this what's missing? People are not broken. Our philosophy is you are not,
not
broken.
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 Yep.
We don't do brokenness. You ain't here to be fixed.
Right. Yeah.
Disrupt that shit. But what are the pieces missing to your puzzle? What are the pieces when we lay out all the puzzles on the table? Which pieces are missing? Which is turned around? Which is, and it takes time to take a step back and look. Who's this human person?
Yeah.
And so our assessment is not just trauma focused, it's healing center, and it's talking about that. What are the pieces to their puzzle before we decide to diagnose or help them understand the condition that they're going through? And so it's, let's look at it. That's our assessment. Assessment is, let's explore. Let's take a step back and see who this person is. And then the treatment plan. We're not doing a damn checkoff list. Just create a damn piece of paper and putting some things on it. Let's look at what was going on with this person. What is the condition impacting their lives? And don't just throw some damn goals on there.
Right.
Don't throw 4 and 5 goals. Are we considering the whole person? So we're not doing that. We're doing 2 goals.
Yeah.
Are they in crisis? Crisis can be a goal. They don't have to be this fancy setup language. What are the 2 things that's impacting their functioning? Because remember we talked about African-centeredness is about human functioning.
Yes. Yes.
Not a quantitative checkbox.
Yeah.
Yeah.
And a case number. What is impacting their total functioning right now?
Yeah.
Why are they here? Why do they need support? And then let's center the goals. Center, right? So now we're talking about, so for those that don't know, client-centered, patient-centered, those are terms in the industry. Here, we don't refer to those we serve as clients and patients and consumers. We refer to them as family members. So you'll hear those words interchanged because of industry and us working in and out. But when we refer to our family members, they're the members we serve, our family members. And it gets a little confusing because we're like, we're family members, you're a family member. Everybody's a family member. And we do have to say, oh, wait, that's a client family member.
Yeah.
Oh, wait, that's a staff family member. Oh, we talk about extended family members. So, hey, y'all, extended family members are our community partners.
Yeah. Yep.
Okay. And so when we were doing this process, when I was looking at it, I'm like, no, treatment plan, don't just do a damn checkoff. Yeah. let's think of 2 major things, because it can be overwhelming thinking I have to change all these things. And that's what we're implicitly, right? We talked about that. So we were talking last time about how someone's crying, you give them a tissue. There's a silent communication, but it's to stop crying. Well, if we are giving them all these goals and helping them to create, first of all, let's not give them the goal, right? People are creating goals without them.
Well, and I was going to say that also. So the goals are not created by us. The goals are created by them.
Right. Absolutely.
And together, we're supporting them that, right?
Yeah.
Like they're
Holding
telling
them
us
accountable.
that's right. And there's accountability on that damn thing. It is us.
Yes.
This plan is us. It's your individualized plan. And so what we said last week is that healing is an internal journey that happens within community. Well, this is your plan with community.
Right. Absolutely.
How are we being held accountable to this plan? How are you being held accountable? If you got family members, who else need to be on this plan to help support you? We're all centering and surrounding you. That is a collective approach.
Absolutely.
And others have taken treatment plans to just think it's a piece of paper, put these things out, and don't understand that this is our roadmap. We just talked about it.
Yes.
It's to learn your way, not keep doing this GPS system. Let's build the roadmap so we actually learn the way.
Absolutely.
Not overwhelming them also.
And not, if I gave you the directions for 3, and you're like, okay, turn where? Turn left, turn.
Yeah.
Let's start. Let's just practice driving in the parking lot.
Yes. Yes.
Now, then we could take the highway. So that's the first 2 goals is for this year.
Right.
And that is the way we should be operating. And it's hard because we have to unlearn things that we've learned.
Yeah.
And that roadmap is so that they can take it after here. Not to just memorize and regurgitate it. No, this is your roadmap. This is what's impacting your functioning as a whole being without being a whole person.
Yeah.
And then what do we do? What are the objectives? What are the tasks? So that's the interventions. What do we do to help you? What is my role? What am I teaching you? What am I guiding you towards? What am I processing with you?
Right.
What am I helping you to develop? What skills am I helping you? Not telling you what to do and giving you tools that you don't even have the skills to use.
Yeah.
And now we have our roadmap. So even if you get lost,
You can refer back.
you can go back to your roadmap. You can go back to your own self-study. It's centered
Yes.
around you. You don't have to be dependent on me all the time.
Right. Yeah.
Right. And then we move to that with our treatment. And so our treatment is a little different because we have, and what we realized, I said, y'all know we do relapse prevention from the beginning. We prepare for termination from the beginning. We're not waiting to we're not reactive.
Right.
So we have a crisis toolkit that is saying, when you came in the door, you came in with strengths, you came in with knowledge. What worked for you when you came in the door?
Right. Absolutely.
Because most times we don't know. You ask me, I'm like, I don't know. And then when someone sits down and say, sit down and honor this shit right now. It's like, well, I did this and I did. Why are you not doing it now? I don't even, because I didn't think about it. Because you are not practicing honoring that time. So the crisis toolkit is to take a moment. Think of what did work that you may not be doing right now. Okay. Well, here's some other suggestions. Do you think it'll work? Will it work for you? Practice. Will it work in this setting? Will it work here? And then after that, we move into a way to really assess, am I ready for this change?
Right.
Where am I in this change process? Because I love saying I'm going to change
deep.
ain't
That's
this
so
shit.
powerful. Where am I in this process?
And
The
am I
change
ready?
process.
Are
Absolutely.
you ready? That
Am I
is
ready?
major, right? We
Right.
can speak about it every day. I mean, how many of us
on.
make the New Year's resolution? We
Yes.
gonna lose all this
I don't.
weight.
Yes.
I don't.
And then you see them next time and they got a bag of Oreos in their hand. But you losing all
Don't be
this
doing
weight.
that. Have me spit my tea out. That will be spilling the tea. We said we're not gonna be spilling
don't
the
spill the
tea. We ain't spilling shit over here. We're trying to.
But it's real, right?
Yeah.
You're not ready for it. You
Right,
haven't
absolutely.
made the goals for it. You haven't created objectives
Yeah.
to
A plan.
reach your goals.
Right.
The
The plan.
And then I did all
like
so
that.
I did all that. I created all that. But shit, am I ready?
Right.
Are you
Am
applying
I
it?
ready?
Was I being honest? Do I have the resources and supports to make this change?
Ooh,
Right.
that.
Exactly.
What are the barriers and blockages for me making this change?
Yeah, we don't think about that. Just this is what I want to change.
And that's
Automatic.
it. And then why
Just
it's not
trying to-
working?
That-
when
that
we're trying to get to
instant
0 to
gratification.
100 quickly,
Say that.
right? Instead of walking
What is that?
slowly.
Instant gratification.
Exactly.
This damn Western individual tells us, just feel good, just get high. Instant
Right.
because how you feel is factual lie.
Right. Right. Absolutely. Absolutely.
Isn't that some shit? And so no wonder why folk think we over here acting the fool because we just disrupting shit. We ain't following that model. And then when we've learned, oh shit, I'm really not ready. Well, what does this look like? What do I need to get ready? Because was I really ready for that? And I'm wondering, but it starts to teach me about myself.
Right.
Yeah.
And it teaches my helper and healer that, oh, this gonna be a while.
Yeah.
And it's okay.
It's okay.
So then now let's look at that treatment plan because I just assessed that after we made them goals, we might need to add some things in here.
Yeah.
We might need to add some other tools as well. Or that might be my goal is to acquire additional tools and resources to get ready for that change.
That's that reassessment.
Assessment is what?
Reassessment.
How long? Do we do it one time?
No. Ongoing, right?
Yeah, definitely.
Constantly.
Isn't you know those cliches we say and don't do shit? Like people do not practice what they preach.
Right. Yeah.
It's a check box. We did the assessment, we diagnosed, we did the treatment plan, we good, we put stuff on the paper and then we in treatment don't know what the hell to do.
Yeah.
Because let's go to the roadmap. Well, it said turn left. Did we turn left? No. Well, why we don't? Then that's where we going back. We coming back. We go on the circle. When we get lost, what the hell do we do?
Go back to where we started. Let's go back and try this again, right?
Go,
Yeah.
I don't
Or
know.
try
Why.
it.
Let me
Not
go
even-
back to. Let me go back to the house.
Let me go back and get started.
And not even necessarily way back. When
Right,
You, got
you don't
started,
have to
right?
go all
Let's
the way
see
back,
where.
yeah.
Let's see where I veered off to the left.
Right. Exactly.
Bring it back.
But sometimes we cycle around that same block a few times to figure out, did I make the left? Did I make the... What's my landmark? Because what's my landmark?
Yeah, I love that.
Wow.
I love that.
Yeah.
That's the milestones, right?
Milestones.
What's the landmark? For me to get recentered. And okay, so I made it right here. So, and we talk about that. A lot of people are like, homework. Yeah, homework. Because your homework is, I had someone I was serving one time, and the person gave me the dopest idea. The person said, so Mama Bay, you mean I'm creating my own self-case study? Yes. This homework, yes, you are creating your own goddamn case study. I've used it since. It was the dopest concept. It was like, you got this.
Yes.
Yes, you're creating your own case study. So when it gets time to challenge those thoughts, is it true? Right? We say, what's the evidence? Is it
Yeah,
true?
right.
You got the evidence in your notebook. You ain't depending on me to tell you. You ain't depending because you can go back from day one to see.
Right.
I made a left here, so it was working. Because I always ask, go back and tell me why is it not working? Why are you not able to cope? Why are you not able? I don't know. It's not working. I didn't. What are the tools that you told me you had? I didn't. Go back to your page for the first 3 weeks and tell me, because it seemed like you were tracking. And so where did you go right? Where did you turn left?
Yeah.
What was different?
Yes.
Was there any major experiences
Yeah.
that shifted? Because maybe there was a detour.
Right.
But you have to learn that about you.
Right.
What was your detour and why? Okay, so that makes sense.
And
So?
I'm glad you said that because it's so important to do the homework, right? It's so
Oh my
important to do
gosh,
the work.
right?
I have a couple patients I've been working with, and I often quote you because I say, I said one of my mentors say, you have to do the work. You have to do the
Come
self
on now.
work, right? You have to do it. And then a couple times I have a patient walking in, I haven't done any of my homework. I said, okay.
Right.
What's the dilemma?
That part.
We need to continue to do that self work so we can continue to build that roadmap.
Right.
To help
Man.
with those transitions.
Wow. Girl, that's self-work.
Absolutely. You have to do the work, you have to do the homework, and it's so important. That's what I, try to emphasize to my family members that come see me for medication management.
Right.
Absolutely. Right. And I think you were saying something earlier, right?
Making them choices. She's Mama Bay is an excellent mentor.
Yeah.
You have gotten do the work, and what has stuck with me, and what I use quite a bit is I choose.
I choose.
Oh,
I love that. I
we all choose
choose.
today.
There you go. I choose.
We chose, and y'all chose to be here. That's what you did.
Absolutely. Thanks for coming.
So with my tobacco recovery cessation groups, as well as the parenting groups, I have gotten a response. One specific person has said, Sand, this is an amazing catchphrase you have that I choose. I use it every day. I said, it's technically not mine. However, I use it, and I give Mama Bay credit for it because it's so real. It is as raw and simple as that. I choose. If I want to lose some weight, I'm going to choose not to eat that cheeseburger. If I choose not to smoke cigarettes anymore, this is what you're here for. You chose to come to my class.
Yes.
You chose to come seek assistance. So it's up to you to continue to choose every day not to pick up that nicotine. Right?
So why I choose isn't yours?
Well, meaning that I didn't create it.
Okay, it's part. People been saying I choose on my life. We may not have been using it in the way we do.
Yeah.
Right?
Yeah.
It's ours. That's the collective thing. That's African centered. No one person can own it. Yeah, I might have what they call coin it or I say it, but people have been saying that, right? It's still ours.
And that proves right there the conditioning that we still have. I've been with the family for quite a few years now and still working on that.
Yeah.
We
That
choose.
collective.
Yeah.
We choose.
Yeah.
Yeah. And that's the thing about treatment that a lot of people, right? With ours, it's going into that, reminding ourselves. If we get lost on that treatment plan or that blueprint, how do we come back to recenter to say, wait a minute, you know what? I do choose. This is ours. This is a collective journey. I don't need you to come. I'm not going to wait till I get to the session to do the work.
Right.
Because I got to do the work in between sessions. I have to practice each day. I have to do this. And, when I think about people, so them not people. We own my shit now. So we have other shirts that say I own my shit. Let me do I. And this just came up this week. And if I hope my children, y'all asses better watch this, okay? Because I'm owning my shit for y'all. Okay. Let me start by, I want to thank our brother CJ, because you know how many years folk have been telling me to do a podcast, and I was like, hell no, I ain't doing that. I ain't sitting in front of no people's cameras. And how long the family has been, people in the world, trainers, and I was like, I'm not doing this. And here we are, right? And it ties back to my healing work. Growing up as a Black girl who had this giftedness, who absorbed these resources, who all of these things, and being conditioned that I'm not worthy, or who am I? Because I've been told you think you know it all the things. And I've done a lot of great healing work. And the cameras on me, all eyes on me, I'm good in background. Don't look at me. I don't do as well with compliments. I'm getting better, y'all. And it was a time where Baba Coach on my children, particularly Baba Coach, he was like, just practice. Just come on, let's go. And I'm like, he goes, do this. Thank you. And keep going. Like, even if, because usually I'll turn away, I'll go, I'm trying to find words. And so I'm watching my daughter. She does it. And then he goes, who that look like? I was like, I don't know why you, girl. I said you so pretty. And so why? And I was like, oh. And I choose, right? And thinking about that and saying, oh, yeah, I could do this. And that ain't always the case. And knowing how to receive and accept compliments and things. And I've had to work on it.
Yes.
And I've had to dig into that. And I think about that, that work. So when we're thinking about these things, when we think about family-centeredness, people they've had that experience of being told I'm not important. Yeah. They've learned in their brain I'm not worthy. So imagine a healing journey, imagine how your services are centered
Yeah.
and focused all on you. Imagine when everyone in the house is like, hey, you, when you can tap into different family members for what you need. And it's still centered on you. If I know my pain and struggle in that,
Yeah.
imagine what a person-centered
else.
is looking like. So I might reject it. It's foreign to me.
Yeah.
Yeah.
Wait, you want me to decide my goal? Wait a minute. No, just tell me what to...
That's not what they're used to. It's not what we're used
This
to.
not okay. Well, other
absolutely.
people did it. And so it seems harmful. I don't feel safe.
Right.
Yeah.
Yeah.
Because everything is centered on me. And you're all focused on me. Why everybody talking to me? Like what I do. You thinking something's wrong instead of something is right.
Yeah.
Well, people usually just tell me to do A, B, C, and D. Nah, not over here. We don't do power control. We don't do that shit over here. Wait, I could talk how I talk? You're not telling me I don't speak right? You're not telling me that if I curse and... Who says?
Yeah.
Are you
you.
who you are? Are you
Be
human?
you. Yes. Be you.
Be you.
Yeah. Yeah.
Right? So imagine receiving that type of service where it's all focused on you.
Yep.
I don't think we've considered that. We're saying, and others might say the word cliche,
Right.
family centered, person centered.
Right.
But is that practice there? Is it really centered on me? And imagine the rejection that we might get from those that we are centering on.
Yes.
We're circling, we're wrapping you up. They're not used to hugs.
Right.
Even if it's not a physical hug, they're not used to being wrapped in safety, wrapped in comfort, wrapped in love, wrapped in healing.
Right.
Even from when you enter the door, right?
Yeah.
To having everyone in the family come and talk to you.
Yeah.
Yeah.
Or hey sis, hey auntie,
Right.
look, little mama, what you doing over there?
Yes.
Who is you? Who your mama is? I might. What you mean? Why you asking all these questions?
Yeah. Or thinking that's is that
Something ain't
professional?
Right. You
Right.
professional?
Are you
That
professional?
part. Yes.
We've gotten that a few times. Well, what does professional look like?
Right.
Who
Like,
said? Whose
who said-
culture? Whose traditions?
Yeah.
Yeah.
Right. Ooh.
You're expecting one thing. You walk in, you expect sterilization. You don't expect all of the color that we
That's
have.
right.
You don't expect all of the friendly emotion that we have.
Yeah.
Um,
Wow.
that's major.
I didn't just think about that. Like you said, walking in the door.
Yeah.
And then if our assessment is set up to ask who you are as a whole person,
Yeah.
not just the checkout, because we don't. You can't. Our family can't even check it off. You can't even do the click down list. You got to put the answers in this narrative. You got to ask these questions. And so imagine if I haven't even been trained to ask these questions and ask them a different way. And narrative. So then you ask me, oh, you asking me all the questions. Why you asking me this question? Why? Why are you so concerned about me and what happened to me before? Why?
Right.
Why gotta I talk about this?
Yeah.
Because it's about you.
It's about you.
We want to know who you are, the whole person. Okay, y'all. So our time is over. So I think it's about time. Let me do this surprise.
Oh.
Because I was waiting to tell you.
Okay. All right.
So as we're doing this work with the NC Tobacco Coalition, and of course we have all these partners. Well, our new partner, we just got a grant from American Heart Association.
Yay.
So we have a couple facilitators, myself, Lex, and Kafani Bay of Cal Cuisine. And we're going to be doing healthy lifestyles, healthy for life. It's an evidence-based curriculum talking about healthy living, healthy cooking, how you can use gardening. So I was like, oh, that's what we do already. So they were, our
Already do
partner was
it.
like, what?
Yes.
Oh, it's a wrap. We got you.
Yes.
So we're getting kits on being able to do cooking demonstration supplies
Love
so that
it.
we can have, and we'll probably have a traveling bag so that we can
love
do
it.
workshops on site and here. And part of those things are, you know, again, I think we're looking at 6-week groups, and we'll probably do a couple throughout the year or some workshops here and there on these things. And so I talked to one of our a partner from the American Heart Association yesterday. She was like, wait, Isis, like, what about, because you know, we're talking about holistic health, and that's what you all do, and that's why
Right.
we've been supporting you and partnering with you. What about blood pressure? I said, girl, you playing. You talking about blood pressure. I said, you know, did you know we're integrated care now? She was like, wait, what?
Yeah.
She was like, well, I mean, do you have a place place for what? We're a person. It don't have to be confidential, but semi-private. Do you have a space for people to do self-check blood pressure?
You have a space.
I was like, say more. Say what? She was like, because we can come out and, again, support y'all financially and set up a whole station, blood pressure check-in station with self. She said, because families, particularly those that don't have trust in systems and may not have a primary care, can check their own, check their numbers, their resources, and then know that, okay, I might need to reach out. I said, they don't even know they living in the house. The person right there can either guide them or we can connect them to private care because we do clinical interns who can help with case management. She was like, are you I was like, she said, email me. I was like, say word. So I couldn't wait.
That is so dope.
So I was like, we could probably set it up right in because you don't have, we keep things locked, but that can be a space where they can come in.
Absolutely.
And still have that semi-private. And I was like, do you know what she does? This is her specialty.
That's awesome. Yay.
So
thank you, American Heart Association.
That's right. So shout out to our partners. We'll be implementing. So again, holistic health. When we said true holistic wellness, true family center, we are centering.
Absolutely.
Definitely.
We are not your average mental health agency. We are the community's home for healing. Holistic healing at its best. Peace, y'all. Don't forget, come see us. If you want to be a family member, join us. www.harmonyhealthpllc.com. Follow us again. Join us next week. We're going to talk about that. We started about medical. We're going to have to bring that in. Medical trauma and generational trauma.
Trauma, yes.
Come back through. We're going to take another one. Make sure you have your tea. Peace. Wow. That was a journey. And thank you for joining us. If you'd like to join our family, visit us at www.harmonyhealthpllc.com. And if you want to take the next mission with us, you're more than welcome. Come visit us back on YouTube. And till then, don't forget your tea.